Hi, everyone. Good morning and welcome back. Well, if you're starting to see people with that 5 o'clock shadow, this month is No Shave November, also known as Movember. It raises awareness for men's health, specifically about serious cancers such as prostate cancer. So joining us this morning, we have Dr. Jeffrey Ranta, a urologist with Hartford Healthcare, Talwood Urology and Kidney Institute at St. Vincent's Medical Center. Doctor, first, I want to thank you so much for joining us today.
Well, thank you for having me this morning.
It's an important topic, and I want to start with what the warning signs are that men should not ignore when it comes to prostate cancer.
Well, men should pay attention to any symptom or any problem that they have passing their urine. That should normally be an effortless event that you don't really think about and just happens. Anything that interferes with that should be brought to the attention of a healthcare provider. In addition to that, prostate cancer sometimes has no warning signs and no symptoms whatsoever. And therefore, the annual physical exam and annual blood tests are very key to finding this disease early.
Wow, scary to think that there could be no symptoms leading up to it. Now, 1 in 6 African-American men will develop prostate cancer. That's disturbing. Why is this group of men so much more at risk?
The question of why something happens in medicine is very difficult to answer, but we do indeed know that African-American men are at higher risk, as are men with strong family histories of prostate cancer. And it's those men particularly who need to be monitored and screened very carefully by their primary cares. Prostate cancer obviously can happen to any male, but African-Americans and folks with family histories need to be especially vigilant with tests. And as you mentioned, often there are no signs to give the warning. So an annual examination is key, particularly for those folks.
Now, is this like a mammogram for women where you should start at a certain age? Is there an age group that should really start getting this checked out? Or is it like an earlier, you should have this at any age?
Excellent question. And yes, there are ages that are age appropriate. And again, it depends on risk categories. African-American men and men with strong family histories should be screened beginning at 45. Men without, Caucasian men and men without strong family histories can be screened at 50 or 55. And this is really a dialogue and a discussion between the man and his primary care provider.
Okay.
But the earlier we find this problem, if the problem exists, the earlier we can have significant impact on longevity and overall health.
All right. And I know, are you taking part in No Shave November? This is something a lot of people are doing to raise awareness. It looks good if you are.
Yes, I am. I'm not sure my wife's too happy about it, but anything that we can do to raise awareness by men and their spouses or their significant others, anything that we can do to raise awareness for prostate cancer and prostate wellness in general, we think is very valuable. And opportunities such as this are key to getting the information out.
Oh, it's a small price to pay to raise awareness, Doctor. Thank you so much. Really appreciate your time today. And I know people may have questions about treatment options and all that. Would you recommend they head to hartfordhealthcare.org/
That would be an excellent place that they can find some up-to-date information, and we will get back with them as soon as we can.
Excellent. Doctor, thank you so much for your time today.
Well, thank you for this opportunity. I greatly appreciate it.